So management options in patient. So suppose a patient is on warfarin and he develops the intracranial hemorrhage. So how do you manage this case? So suppose the patient is on vitamin K. So first thing, the option is to give vitamin K to this patient immediately. That is, you have to give either oral. Traditionally, we used to say that you should give 2.5 to 5 mg oral or IV of 0.5 to 5 mg. Now, modern guideline has now been evolved. Now, the guideline says that the vitamin K dose in patient with major bleeding or intracranial hemorrhage should be 10 milligrams intravenously of vitamin K. And always remember that there are risk of 3 per 1 lakh risk of anaphylaxis. So it should be always be infused very slowly. So vitamin therapy alone will require 12 to 24 hours. Reversal begins within 6 hours. So generally it takes 12 to 24 hours time for action to reverse warfarin coagulopathy, and thus it is not recommended for immediate reversible as in case of intracranial hemorrhage. So you have to give this drug, but along with that you should make sure that you give other therapies to rapidly reverse the warfarin induced coagulopathy. Next therapy which you can do is also remember that if the INR is not normalized within 24 hours, you have to repeat INR and may have to give a second dose of vitamin K. Second option is the plasma therapy. So plasma therapy is nothing but, as we have already discussed, that after giving when ablation, any person donates a whole blood, so it is centrifuged into packed cells and platelet-rich plasma. And when this plasma is separated again, platelet is separated again, and the fresh plasma is there. This contains all the clotting factors. So since vitamin K antagonist is against the clotting factors, you have to give clotting factors in this patient. But the only problem is that since it is a plasma, it contains a large amount of volume, and for to reverse that, may have to give a large amount of blood or a fresh frozen plasma, which may lead the patient into volume overload status. So you have to be make sure that patient is not too much volume overloaded, and you may have to give a diuretic therapy in between. So dose of plasma therapy is that minimum of 15 ml per kg or 30 ml per kg has to be given, or you have to give 4 to 8 units in an adult patient. Okay, so this 15 to 30 ml per kg is the normal dose of fresh frozen plasma. Next, most important thing is prothrombin complex concentrate. So this is previously there are few contains prothrombin complex concentrates three factors, that contains factor 2, factor 9, and factor 10. It generally does not contains factor 7. So this is not useful in patients with warfarin induced coagulopathy. In warfarin induced coagulopathy, the main thing is that it should contain the factor 7, and that's why 4 factor prothrombin complex concentrates are generally used. So what is the recommended dose is that suppose the patient is INR is within therapeutic range and has developed ICH, then the dose should be 25 international units per kg. Or suppose INR is in exceeds the therapeutic range, then you have to give the dose at 35 to 50 international units per kg. The safety of prothrombin complex concentrates in the setting of emergency reversal of warfarin and aggression remains a subject of debate. So what is the problem with the prothrombin complex concentrates is that there is high chances of, because it contains a clotting factor, there is high chances of thrombogenicity. So this, when after administering the plasma concentrate, patient can develop thrombus, but when patient is having intracranial hemorrhage, the risk of thrombosis is much less. However, the benefit can be much more. So that's why, so irrespective of the risk of thrombosis, you have to give the uh, 4-factor prothrombin complex concentrate. However, note that it has been recommended that few studies says that whenever possible, patient who are receiving this prothrombin complex concentrate should be under low dose heparin prophylaxis. But in the case of active intracranial hemorrhage, it may not be possible to give heparin. But so here in this case, the benefit of prothrombin complex concentrates is much more when compared to the risk of thrombosis. So it has to be administered in this case. Another limitation of prothrombin complex concentrate is that it has a potential risk of transmitting infectious agents. Even though use various processing methods as nanofiltration or vapor heating, we can use that. However, there has been reported cases of parvovirus B19 seroconversion have been reported in recipients of prothrombin complex concentrates. So when you compare fresh frozen plasma or 4-factor prothrombin complex concentrates, the fresh frozen plasma takes longer time to administer because it's a large in volume. You have to be very much careful because the large amount of volume has to be given to the patient. It can transmit very large amount of diseases, and there is a risk of transfusion related acute lung injury. The similarly, when we take four factor prothrombin complex concentrate, the limitation is that their availability is limited, and some preparation, that is the three factor plasma prothrombin complex concentrate, lacks factor 7, and it requires almost a donors of around 3,000 to 20,000 donors as required to generate this in sufficient amounts, and it can transmit some diseases, and the main limitation is its thrombogenicity. Now is recombinant factor 8(7a). This is a new one. It is still off-label, and the dosage recommendations are currently unresolved. So generally, the dose they say is the fixed vial dosing of 2 mg will provide you 20 to 40 grams per kg for patients between 100 kg and 50 kg of body weight. So clinical benefit in these settings have not been established, and there is a high risk that this recombinant factor 8a can develop arterial thrombotic complications. So on summarizing, so suppose any patient has developed, warfarin patient has developed uh, bleeding of or intracranial hemorrhage, you have to give vitamin K. Along with that, you have to do for rapid reversal, you can either give fresh frozen plasma or you can give prothrombin complex concentrates. So ideal one is prothrombin complex concentrates, but this may not be available every time. So if this is not available, you can give fresh frozen plasma. The dose is 15 to 30 ml per kg. And the new one is, that is recombinant factor 7 is still under study. Thank you.